communication, clinical practice settings, and beyond. A few words to get us started. First step should always be to start at the beginning. And it is critical that we connect with our shared humanity while delivering healthcare and by being engaged in a dialogue. So how did we get here today? Not the literal sense of computer entry and personal ADLs, but think about the last time you were in a healthcare environment, academics or clinical practice, and were you really communicating with others? Were you observing or directly involved? Did someone notice you or interact with you? Did you notice or interact with someone else? Or was it a blur of conversations in the background as you entered documentation on the computer screen, or taught in the classroom setting, or just waited for the elevator door to open? Or did you walk down the stairs? So let's use some real world examples to let us see what we're dealing with. Believe it or not, these statements came from practicing nurses. When I was teaching nursing students, one of the key points that I made with all students is don't ever tell me you don't know. Because as the slide indicates, once you have said that, your brain literally shuts off, and indeed, it is very much like Elvis has left the building. No one knows everything, least of all me or you, but the key here is to get or locate the information and become actively invested. More doses of reality in the clinical setting. It is hard to believe that this occurs and that no one is impacted or responds to the statements. The first statement was from an ICU physician describing fluid taken during a thoracentesis procedure. There were two in a few days. The first one, a liter of fluid was drained, and then the second one, 650 milliliters of fluid was drained. But again, not a problem. Fluid shifting is something that occurs but has no impact. The second and third statements, again, occurred. I don't know about you, but when someone doesn't look you in the eye, that is a scary experience, especially if they are taking care of their loved ones. A simple no can't ask a question because I guess family or healthcare providers are not allowed. So let's look at some concepts. Let's start out with what is. I remember when I started clinical practice, and the nurses actually talked to each other and asked us questions to research ideas and all possible etiologies or treatments. Then let's treat the concept why. It was and still is a very important question. It's almost like a toddler age group when you're constantly asking you to help them process reality. Lots of things to consider. Why? Then we switch to how. Besides the paperwork and the checklist, there was an examination whereby one observed, touched, calculated, discussed, and authenticated the good information. And then finally, there was an actual sharing of information where the plan of action materialized and actions were planned in it. So what does the literature tell us? Actually, I did two searches, one in PubMed and one using a straight Google search. For the PubMed search, I used the keywords of communication interactions and clinical practice settings. In terms of filters, I used the last year, free full text, pen review, and systematic review. I got 4 entries, but I only actually used 3. So let's look at what the PubMed search told us. Well, there are common attributes that need to improve communication. And yes, Virginia, there is a practice theory gap between the classroom and clinical setting. How many students are in clinical without benefit of an instructor on site? Who can you go to when you have questions? Where is the partnership experience between educator and student? The second theme, the patient shift, has also occurred. This has unfortunately been fueled on by COVID-19, where interactions were not allowed, and the virtual experience took over for reality. And now we are shifting even further into the realm of AI, not only for teaching purposes, but for learning purposes as well. How can one define the information people are generating if we are not allowing AI into the environment? Is there such a thing as an individual thought based on one's inner perspective? And And where are we getting our information? We have to make sure that it is pristine. For the Google search, I used communication interactions in a clinical setting and looked at journal articles. Believe me, there was an infinite number of web pages, and blogs, and research articles, but I ended up looking at 11 research articles. So it's important to recognize communication channels. Most of us will automatically consider verbal and nonverbal, but the real problem emerges when one does not consider that listening is an active, not passive concept. Research has shown us, as well as common sense, that communication is an important skill in the competence of healthcare providers. Best practice tells us that one must foster the relationship, gather information, provide information, develop decision making, enabling treatment related behavior, and responding to emotions. And yet, there are also barriers at different levels within the healthcare structure. At the institutional or healthcare level, we have a nursing shortage, burnout, limited time, focus on tasks and management styles. In terms of communication related, does anyone really speak the same language anymore? And environmental factors such as noise, lighting, and ventilation, which harken back to the days of Florence Nightingale. And lastly, personal and behavioral culture and failing to observe and or respond to recommendations given. How many times is the same information conveyed within the healthcare setting, but never really acted on? The next theme emerging is that there are models and powers, and this is acronym supported. We have relate, which is reassure, explain, listen, answer questions, take actions, and express appreciation. We have the STICC protocol, situation, task, intent, concern, and calibrate. The base protocol, background, affect, troubles, handling, and empathy. And lastly, the PC4 model, a person-centered care model where the 4 C's of patient-centered care are care, compassion, confidence, and communication. The last theme is strategies that matter. If you look at 2 different websites, Tulane University and the University of Minnesota, you will find that there is information to help you facilitate communication. There are steps that are given, such as Tulane, sit down and be humble, ask only questions, speak in plain language, keep communications confidential, hire interpreters, and culturally competent staff at every level. At the University of Minnesota, they give you 6 reasons. Facilitates better decision making, facilitates effective team coordination, streamlines operations, enables efficient resource management, ensures compliance with regulations, and strengthens crisis management. This slide is a really interesting slide because it gives you the circular concept of reality. So starting at number 1, if we already know that we have a problem, unfortunately, why do we seem to keep repeating it? Technologies entered the healthcare workforce supposedly to make things better. And yet, even with technology, we are still seeing repeated errors, and sometimes just different errors. So how do we learn and adapt so that we can move forward? And finally, let's agree to make a difference. So where do we go from here? Let us take that next step together. Let's bring back humanity and compassion into the healthcare setting. Think before you speak, and speak after you have thought about what you are going to say. Your cell phone and computer or CAL, computer office workstation, are great, but they are only appendages and not really part of the compassionate care communication network. So step 1, be present, be engaged. Step 2, be aware of both verbal and nonverbal cues. Step 3, focus on the person, not the disease. And step 4, be responsive and remain present and engaged during all interactions. If we integrate our core values of humanity and compassion into our daily practice routine, we will improve all aspects of care and demonstrate that the person, The individual, the family, the population maintains a pivotal role in preventing, restoring care for all. This slide represents a simple timeline page whereby one should remember, do, and then act, implementing an RDA. Think of it as a recommended daily action rather than a recommended dietary allowance. The first step to remember, maintain that eye contact, even though your face may be covered. Be aware of your body language. The second part, do. Speak directly to the person or people in the conversation. Make sure you are heard and that you understand. And 3, act. Listen to what they are saying or not saying and provide a response with validation to determine understanding. So let's implement the Compassionate Care Communication Network, CCCN, into clinical practice. I often use movies to illustrate points in my lectures to hopefully integrate a shared experience in which to maintain a connection between theory and practice. In terms of advancing communication, I have selected 2 clips from the movie Awakenings, which was based on a true story of a clinician working in a state mental hospital where there were barriers to communication. A group of patients who were catatonic were diagnosed with sleeping sickness or encephalitis sulfagina. The doctor used L-dopa, typically used to treat Parkinson's, with some amazing responses. In the first clip, it is a result of a Ouija board interaction between the doctor and the patient in which the catatonic patient communicates. The doctor then discovers the depth of the patient's feeling. The second clip is the dramatic first response when the L-dopa is effective and there is an actual communication. This demonstrates that everyone should go that extra mile to reach out and communicate to their patients and within their interdisciplinary routine. Let's listen. It has been a pleasure to be with you virtually. And I wanted you to remember that what brings us together to share our humanity. Let us continue to be compassionate and engaged with both our patients, our colleagues, and the world. To share with you one of my favorite poems, the importance of both physical and spiritual health. If thou of fortune be bereft, and in thy store there be but left 2 loaves, sell one, and with the dole, buy hyacinths to feed thy soul. Thank you for sharing this conversation with me. And lastly, let's give credit where credit is due.